idea is to bring a community where everybody is free to talk about their mental health without fear of stigma. You ask all the questions. So apart from the speakers and presenters today, we also have like in-house doctors. Dr. Chudu Ufondu is one of our board members and management committee member. He's very vast in knowledge when it comes to mental health, and any support we can't give you here, we'll signpost you to organizations who will be able to support you, okay? So feel free, ask any question. This is a safe space for everyone. There's no question that is dumb or stupid. So it's better you ask the question. We just want to give people the opportunity to ask any question regarding their mental health. And we can't really say that we'll have all the answers for you today, but we will email you or take your phone number and contact you if we need to get more information from you, or we need to signpost you to a therapist who can help you. So once again, welcome to FACEYOUTH Mental Health Awareness and Stigma Reduction Seminar, March edition. Just tell us when you come in, you tell us where you are joining us from. Yeah. And remember, invite your friends. Don't keep it to yourself. So share. Tell a friend to tell a friend. You never know who might need it. So invite someone. Just take 1 minute to share the flyer with somebody. Welcome everybody. Hi Noah, how are you? Welcome back. Hi, hello. Okay, I guess you want to talk. Okay, you can unmute yourself and tell us. Yeah, talk to us. We like people to talk to us.
Hello, my name is Dr. Uche Noel Martins. I am joining in from the US.
Yes, we're always happy to have you.
Minnesota, precisely. So if he actually, yesterday I was thinking it's my 9 a.m., but I forgot that we changed time last week, Sunday. Okay. Our time changed. So right now it's 10 a.m. actually.
Well, that's
not 9 a.m.
Yeah.
Okay. But very soon you guys will also change your time. Maybe by tomorrow.
Yeah, or by next week. The week after next.
Exactly. So, and it will go back to my 9 a.m.
Okay.
If it does, I might still be sleeping by 9 a.m. Okay?
That's okay.
Good. And I was thinking that we've done so much about stigma reduction and things like that. So will you be coming up with fresh topics? You understand, you research into more trending topics, more topics that are more, will I say, that are more new, that people don't know much about in subsequent editions?
Absolutely, Doc. Yeah, absolutely. Thank you so much for the question. Yes,
okay,
so then. The way we select our program is structured in such a way that we try to follow the United Nations calendar. So whatever event is happening for that month that they're associated or affiliated with our vision for FACEYOUTH or our mission of FACEYOUTH, we try to go towards it. We also tend to have our young people choose topic that they want us to address, right? So we have a group of volunteers, young volunteers, and we just bounce off the topic around them. Okay. So this month, because it's International Women's Month, we are excited about it. We want to talk about women all the time. But that's not to say that we don't want the men to listen in to join us, because we want them to know how to support their partners, support their daughters, support their friends as well, okay? So
as well as their mothers as well.
Exactly, it's very important. So I told somebody that we can never win this war of inclusivity or inclusion without involving the men, right? They have to be part of the discussion. So that's why it's open to everybody. So when we shared, people were asking me, is it just women? I say, no, it's for everybody. So we will go ahead right now and start and give people the opportunity to join as we go along. So welcome everybody to the march.
Thank you.
Thank you so much, Uche, for that question. Yeah, Noel. Thank you, everybody. Thank you. Please share with your friends, invite them to come along. As you all know, this program is being recorded and streamed live. I don't know if it's streamed live yet on Facebook, but we normally stream live on Facebook and YouTube. So welcome to the March edition of the Face Youth Mental Health Awareness and Stigma Reduction Seminar. So as you all know, today is a very special day because we were talking about, we have subject matter experts to talk about postpartum mental health and menopause. So we tagged today addressing stigma in honor of International Women's Month. Okay, so sit back, relax, get all the information, join the discussion. We like to make it very interactive. So if you have any question, if you just raise your hand, we'll come to you, or you can drop your question on the chat box. If you want to make it anonymous, you can send a message to any of the Face Youth tag names. Like you can see the Face Youth SCIO is supposed to be Praise Face Youth or IFI Face Youth or the Face Youth IT. And we'll take the question and send it to the moderator. So today we have, my name is Ifi Anyebu. For those of you joining us for the first time who don't know who I am the founder and the convener for Face Youth. Face Youth is the foundation for advancement of child education and youth empowerment. So it's just a grassroots inspired charitable organization committed to improving the lives of disadvantaged children and youth in Aberdeen and abroad. So we say abroad is globally, right? So it's a global charity, but they say charity begins at home. So we've just started small from Aberdeen, but we have outreach in Nigeria, Ghana, and Malawi at the moment, and we'll gradually expand to other parts of Africa and the world, okay? That's the vision we have for Face Youth. Yeah, so we have, for over 5 years, Face Youth has been supporting individuals and families and communities through various projects and initiatives, from awarding scholarships to indigent students and running and hosting sessions on mental health awareness just to support young people and their family. We also run holiday skill clubs for children in Aberdeen. And the next one is coming up during the Easter holiday from the 2nd of April to the 12th of April. So we'll be sending out information for those in Aberdeen. So this program is offered to only those in Aberdeen because it's also sponsored by Aberdeen City Council and McDonald Foundation. So without further ado, I would like to introduce you to your our moderator for today, who is Alice Adam. Alice Adam is a neuroscientist and a researcher. She's also a great friend of Face Youth. She believes in the vision I have for Face Youth, and she's ready to support it with her time, talent, and treasure. Thank you so much, Alice. Would you like to unmute yourself? And it's over to you to introduce our speakers today. Sit back and relax. We have great speakers who will be taking on the topic of today. Thank you.
Thank you so much, Ife. It's such an honor to be here, and just an honor to be in the midst of all these wonderful speakers that we have, and everyone else that's joined today. It's going to be an interesting one, especially as we focus on postpartum depression and menopause, and these are things that affect mothers, grandmas, and being able to have our children aware of this is just as important, but also being able to know for ourselves, which is why I'm so excited to actually introduce Susan Grayson, who's our first speaker, and she actually has an organization called Unique, as in YOU, like unique inclusion. And that's about diversity, equity, and inclusion at a consultancy founded by DE&I consultant, ICF certified coach, and menopause trainer, Susan Grayson. With over 30 years experience in the energy industry, Unique Inclusion has a unique insight into DE&I within a corporate environment, and drawing on this expertise enables us to successfully engage with stakeholders at all levels, from technical and commercial teams to executive leaders and boards. Through interactive training sessions, reviews and programs and resource groups, Unique Inclusion helps organizations raise awareness of unconscious bias, conscious inclusion, cultural competence, and inclusive work environments. And as part of its diversity, equity, and inclusion, that's DE&I consultancy, Unique Inclusion offers a comprehensive range of services to cultivate a diverse, equitable, and inclusive workplace. So by applying external insight to create people-focused strategies, policies, initiatives, and programs, Unique Inclusion is encouraging the promotion of a diverse and inclusive culture for companies across the world. And I'd just like to introduce her to speak to us concerning menopause and everything else that her organization does. Over to you, Susan.
Thank you, Alice. That was a lovely introduction and a few tongue twisters in my bio there as well. So maybe I need to make it simpler. Hi, everybody. I'm just going to share my screen. So I will do that first. And you can let me know when you can see my slides. Have we got a thumbs up? Yeah, okay. So first of all, what I want to do is just say a little bit about how I came to the name Unique Inclusion. Unique Inclusion is called that because inclusion is about you being unique. So that's where the name came from, really simply just about being a unique individual. And today I'm going to talk about menopause. I think my slides seem to have just taken on a mind of their own and seem to be going forwards without me pressing forward. So I'll try and solve that. But I'll go back to Unique Inclusion. So the services I offer, as Alice mentioned, is mainly around DE&I consultancy. Also, menopause is a focus area for me. And today I'm going to focus on menopause and share some of the facts about menopause with you. And I think we can ask questions at the end. Okay, so I'm going to talk about what you need to know, who's affected by menopause, what are the symptoms, and why we need to also consider menopause at work. We spend a lot of time at work, and so having a supportive environment at work is really important. I don't know why my slides are going forward by themselves, but there may be some kind of gremlin at play here. So what I want you to do is type in the chat words that come to your mind when you say the word menopause. Okay, where are they any of these words? Sweaty, hot, moody. Think about how these words might make you feel. And would menopausal individuals or staff like to be described that way? I'll just go back. I'll not let this speed me up. So did we get any words in the chat? Has anyone added anything? No? Okay. So what we think about when we think about words like this, they're quite depressing words. They're words that maybe you wouldn't like to be described yourself. So when we think about menopause, we're trying to change the conversation to a more positive set of words around menopause, because these are all quite negative terms, but they are the terms that research tells us people talk about when they say the word menopause. So try and think of menopause as a more positive period of someone's life where they're experienced, they're confident, and they make a difference. So thinking about the words we use is a good thing to be mindful of around menopause. I'm going to talk about what menopause is. Now, menopause is actually a few different phases of the hormonal journey, and we'll start with perimenopause. We'll talk about menopause itself, and then we'll talk about the post-menopause stage. So, menopause is actually in the UK on average from ages 45 to 55. The average age that we get menopause in the UK is actually 51. But menopause is actually in itself a one-day event, and it's something that's described as a retrospective diagnosis. So you don't actually know that you've experienced menopause until you've had 12 months without a period or 12 months without menstruating. So people get quite confused around where they are in the menopause stage because it's really difficult to know exactly when you've experienced menopause. But in the run up to menopause actually happening, you've got a period of around 3 to 7 years that we call perimenopause. Now that's the point before you actually experience menopause, and it can be prior to age 45, but it can happen anytime. It's a very long range of time in your life that these hormonal symptoms start to show up. But on average, before you hit menopause, you might experience symptoms of menopause for around 3 to 7 years. Early menopause, Alice and I were just talking about before we came on the call, can be anything from as young as 40, but in the UK there have been recorded cases of menopause from as young as age 12. So menopause is something that can be quite shocking for someone who's very young, because if you're still in the stage of life where you want to have family and you have menopause, that's really distressing, and particularly for your mental health as well. So early menopause does happen, and premature menopause, which I've just spoken about, would be from a very young age. But after you have experienced menopause, so when you've had no period for 12 months, then you are classed as postmenopausal, and that sits with you for the rest of your life. So if we think about symptoms and mental health, then it's a long period of time, and that's what I'm trying to show here in this slide, is that you are menopausal for a large stage of your life these days. And historically, menopause was actually an end of life transition, but it's now, because we're living longer, menopause is actually happening much earlier in our lifespan. So women and people who experience menopause have these symptoms for a much longer period of time. So that's what these three phases of life are what we talk about when we use the term menopausal. And again, often people don't know that they are menopausal, or they don't know what the symptoms of menopause are and what the stages are. So one of the things I do is try and raise awareness of exactly what these stages are and when to expect them in your life. Because even women who do experience menopause don't know these things, because it hasn't been talked about, and there's been some taboos and myths, and it's also associated with the negative stereotype of aging. So that's why I mentioned some of the words we use around menopausal individuals. Okay, I'm just going to try and stop my slide speeding by flipping back, so bear with me. So when we enter menopause, it's driven by three key hormones. Now, we all have hormones, men and women, biological men and women all have different hormones in different amounts throughout their journey through life. But the three main hormones that impact menopause are these three hormones. So we've got estrogen, progesterone, and testosterone. So these are the three hormones which are going to impact the various stages of menopause. So estrogen, this is our hormone. It's the moisturizing hormone, if you want to simplify it. It's responsible for many things in the body. I think it's over 300 functions. It's produced in the ovaries and also in the adrenal glands, and it's responsible for things like bone density, heart health, skin elasticity. You can see on the list there's a lot of different things that estrogen is responsible for. So you can imagine if we reduce the amount of that hormone, then all of these aspects are going to show up as symptoms in one form or another. One of the most important ones there is really the bone density and the plaque buildup in your heart. So estrogen is a key hormone for long-term health, and we'll come to what happens to that hormone in a minute. Progesterone, this one is a calming hormone, so it has a calming effect on our brains. Again, it retains bone density. and supports our cardiovascular health. So again, another hormone that's responsible for long-term health as well. And it modulates our immune system. Now, testosterone, a lot of people associate this with a male hormone or a sport-related hormone, but women have this hormone too. And it's responsible for bone growth, bone density, muscle development, skin collagen, and a healthy circulatory system. So you can see all of these three hormones have really positive impacts on our bodies. Now, our hormones all circulate around something called the endocrine system. And I will say at this stage, I'm not a medical doctor, so I describe, I'm not prescribing. So I'm just talking about these things, but not from a medical point of view. So our endocrine system needs these hormones, and the endocrine system has receptors which look for these hormones. And very simply, when these hormones decline, the receptors stay there. So they're still looking for these hormones in our system. So again, this is why, in very simple terms, when these hormone levels change, we start to see symptoms related to all of these things that these hormones look after for us in our bodies. And if you imagine that menopause happens now probably halfway through life, or midway through life, these symptoms are around for a lot longer for some people, unfortunately. And when we come to hormones, I love this chart because it really shows you what happens in our bodies to these individual hormones. So you can see the hormones are all mentioned there: estrogen, progesterone, testosterone. And really simply, before we experience perimenopause or menopause, all of these hormones, as you can see at the start of the chart, are in high levels in our bodies. And you can see what happens is after menopause, the hormone levels are still there, but they're much reduced. And that is why that is the actual change that happens in our bodies around menopause. But if you look at that really wavy line around estrogen, this is the most important hormone to think about, because those fluctuations are starting in perimenopause. So that can be, any time really, as we've just discussed, from age 35 onwards, really. Perimenopause is a phase where that hormone really does fluctuate. So in the run up to us experiencing menopause, then that hormone is going up and down, and that can be on a daily basis. And the reason that this is important is because often people say, well, I don't know where I'm at in this phase. And they might go to their GP and expect to get a simple blood test. Well, blood tests are available, but they cannot be used. They're not reliable when those hormones are fluctuating. So one thing to be mindful of, if you do go to a doctor and you're offered a blood test, think about where you might be in that phase, because if you're in perimenopause, then the test may not be very accurate for you. And that can be quite distressing. If you have a blood test, it says you're not menopausal or you haven't had menopause, but you're experiencing symptoms. So blood tests need to be done more than once to try and reduce the impact of the fluctuations. So I would have a test between 4 and 6 weeks, but they're not reliable. The single best way of diagnosing menopause is by tracking your symptoms over a period of time. So just that's one thing to take away from this, is try and understand where you are by tracking symptoms. And if people want to have symptom trackers and links to apps, I can email those out after the talk, because there's lots of supportive apps and symptom checkers that you can use. So really important to track those symptoms. And then you'll see when postmenopause hits, so you've had 12 months with no period, you are postmenopausal for the rest of your life, but you've still got reduced levels of hormone, so you may still experience symptoms. So unfortunately for some, they can experience symptoms for the rest of their lives, really. And you can imagine the impact on overall health by, continuing with reduced levels of these hormones. And this is why the medical preferred treatment for menopause in the UK at the moment is HRT, so hormone replacement therapy. Now in the UK, you will be prescribed bioidentical hormones. Now, as I said, I'm not a doctor, but in its simplest terms, the bioidentical hormones are safer than the hormones that were prescribed many years ago for hormone replacement therapy. So if you do get prescribed these hormones, make sure they're bioidentical. They should be if you're in the UK, but being inclusive internationally, they can be different. So just be mindful of that. And And I do have an information sheet on hormone replacement therapy, which I can also share afterwards. So we'll come to who menopause actually affects. And you might be surprised, it's a bigger group of people than women. I know we're focusing on women today, but if he did say that, you know, it's important that we have men as allies, but menopause actually impacts a much broader group. So women who are female at birth will have a slow approach to menopause. So it's a natural life change. But also transgender, non-binary and gender questioning individuals who might be taking hormone treatments will also experience symptoms of menopause. They won't go through a menopause, maybe, depending on which, if they're changing gender, which either way they're doing that. But generally, they will have symptoms because of those hormones. Cancer patients who might get chemotherapy or radiotherapy or hormone therapy will end up suffering with some of these menopausal symptoms. And again, surgical patients. So if you've had a hysterectomy or an oophorectomy, which is removal of your ovaries, then you will suffer something called a forced menopause, which is very sudden. And if you suffer symptoms, it can be quite debilitating. So for cancer patients and surgical patients, suffering menopause symptoms whilst being ill can be really poor on your mental health. So it's like another layer that often is unexpected, because sometimes, you know, people just don't know or don't expect that they're going to experience symptoms on top of their illness. So if you have people who are going through these treatments, just be mindful that on top of their illness, they may suffer these symptoms too. And also lived experience of menopause is different across the world. So different cultures, religions, races and countries experience menopause differently. And the research, like a lot of research into this topic, has been done on women. So when I talk about menopause, I am talking about it from from looking at research that is female-based, but it's also white female-based largely, which is frustrating because there's not enough research into how menopause impacts different races, different cultures, different religions, different societies. So what is positive is that there are more organizations starting to do better research, broader research, and also particularly around disability. So disability has an impact on menopause experience, and there is no research on that at the moment. But organizations, universities, medical bodies are starting to do and encourage more broader research, which is a positive. Menopause symptoms. So if you can think about symptoms, pop them into chat if you want to. I appreciate people don't often like to chat on this because it's quite a personal topic, but here are some of the symptoms that you might experience. So everyone experiences menopause differently, and some people have no symptoms at all. So just because you're menopausal doesn't mean that you will have all of these symptoms. So that's good to know as well. Some people just experience one or more of these symptoms, but sadly, some people can experience all of these symptoms. So imagine how that might feel every day and how that could impact your mental health. And we categorize symptoms into two categories. So we've got physical and psychological. But also when you look at those symptoms can be indicators for other conditions, other diseases, and I'm not saying menopause is a disease, it's a hormonal change, but it can be confusing. For example, myself, I thought I was suffering with early onset dementia, and I was really stressed about that, but I wasn't. It was actually a symptom of menopause, and I didn't know that a few years ago. So be mindful that those symptoms can be confused for other things. So that is why the symptom tracker is so important before you go and visit a GP to talk about this. Thinking about those symptoms, and I'm just trying to stop my slides doing this crazy fast speed. This is the categories, and what I've done here is simplified them just so you can see that we've got physical symptoms that show up in the body, and then we've got the psychological symptoms, which will not be visible, but people do experience them. So physical ones, I'll not talk through them all, but they're obvious ones. We talked about the hormones. You can see how each of those hormones are having a different impact here, and that's where the symptoms come from. So particularly common symptoms are sleep disturbance and hot flushes. Those are probably the ones that people are most aware of, but all of these other ones, like joint pain, often women think that they're actually just suffering with aging, and their joints are are kind of playing up, but it's actually a symptom of menopause. So HRT can actually alleviate many of these symptoms. Then your psychological ones, which are the really more difficult ones to deal with because they're not as obvious. And I talk about a cycle of symptoms. If you are not sleeping at night and then you're having to get up for work the next day, you might actually suffer with a bit of anxiety, irritability, memory problems, fatigue, all of these things. And then you go through your working day, you're maybe looking after young children, you're maybe a carer for your older parents, and you've got these symptoms to deal with as well. So it's almost like everything converges to really impact your mental health. So when people are going through this, if they're going through lots of symptoms, just be mindful about how hard that can be for people. So how do we manage these symptoms? So the best thing to do is to track your symptoms and then prioritize the top 3, because there are over 34 symptoms of menopause, and like anything, trying to deal with everything at once can be quite hard and difficult. So I would recommend taking the top 3 after you've been tracking them and deciding which ones you want to work on. And there's 4 different ways to think about managing menopause symptoms. So we've got medical, which I've talked about, so hormone replacement therapy. Now this therapy, hormones are available in the UK in different methods of delivery. So skin patches, gels, transdermally, so you can take hormones on through your skin, or there are also tablets. Now, the safest form is transdermal. So if you're going to the GP or your doctor, try to opt for the transdermal methods because they are safer. But there are different ways, and different methods of hormone delivery will suit different people too. So think about that if you're going to the GP about what's best for you. Some people can't take HRT, for example. If you've had breast cancer, there might be medical indications there. So you need to talk to a GP about HRT, and your medical history is really important too. But if you can take HRT, it is much safer than it had they are these days, but there are a lot of myths around HRT which stop women accessing it or taking it when it is actually one of the safer treatments and most effective treatments for most of the menopause symptoms. But it's an individual thing, so one that you need to talk to your GP about. And then there's complementary therapy, so all your herbal therapies. These are effective for some people, but again, really think about talking to your GP about that too, because you might be on some medicines or have a health condition that these herbal therapies can actually be unsafe with. So it's worth exploring, but I would highly recommend going to a qualified herbal therapist and also talking to your GP. So worth exploring if HRT is not for you. And then there's lifestyle, so movement and nutrition. So exercise and thinking about diet, these can have a really great impact on reducing some of those symptoms. So it's worth looking into what exercise makes you feel better and thinking about taking some of things out of your diet that are maybe not the best foods in relation to some of these symptoms. But again, there are experts who can help with that. And then lastly, mental health that we're talking about today. So doing things to improve your mental health, talking to someone, maybe seeing a coach, having a chat with a friend, getting support from some of the great apps like Calm and, meditating. Lots of different ways of managing your mental health are really important ways of dealing with some of these symptoms of menopause. So if you can do something from all of these 4 areas, then you'll be supporting yourself through menopause. And if you know someone who's menopausal and is not aware of these things, then at least you've got some ways of helping friends, colleagues, mums, parents perhaps to go through menopause by giving them some guidance on how they can manage those symptoms. Okay. There we go. So thinking about the research, I won't go into detail on this, but just to kind of give you an idea, 3 in 4 women experience symptoms and 1 in 4 get severe symptoms. So if you think about all those symptoms, that could be quite debilitating for someone. And an interesting fact that in the UK, 1 in 10 women employed during menopause have left work due to these symptoms. And that is about 330,000 women a year leave work because of how they're feeling and their employer hasn't put in place support. So it's really having a huge impact on the UK and on the economy. So when you think about it like that, it's quite stark statistics. And women say, a lot of women say that these symptoms have a negative impact at work, but these symptoms will have a negative impact on your home life as well if you're suffering from a number of them. And interestingly, because of stereotypes and stigmas, many women just don't tell their employer that their absences from work are due to menopause. So that number of 1 in 10 is probably a lot bigger if everyone was actually sharing the information at work. Supportive environment around menopause in the workplace, because many of your staff will be suffering symptoms. Then legislation, and this will be different in different countries. So I do have international resources for menopause, which I can share if you need. But in the UK, we've got the Equality Act, Health and Safety Act, and then the Equalities and Human Rights Commission have also released some guidance. And then we've also got a British standard. So that's just to give you a flavour for if you are going to work, there are policies, there are acts, and there is law that will support you. So now in the UK, menopause can actually be treated under the Equality Act, under age, sex, and disability, or a combination of those, because the symptoms can be so severe. And over a long period of time, there have been some individuals who have taken their employer to tribunal and been successful because the employer hasn't provided reasonable adjustments or provided a supportive culture, a supportive workplace. So it's important to know your rights as an individual when you go to work, but also if you're an employer, what you should be doing for your people. So that's just something to be mindful of. And a lot of people, many people are not aware of that. And then for employers, or for when you go to work, what to expect. If you want to work in a place that is inclusive, then these are some of the things to look out for. You would look out for there being an employee resource group around menopause, be training. There would be something around your benefits package, so access to medical support for menopause, maybe offering some coaching in the workplace, and just having a workplace where you feel included and you can talk about this. So if you are working for an employer, these are the things to look out for. So what does that mean when you actually go to work? Well, these are some of the key symptoms, and these are the things that can be put in place. Often employers just provide a desk fan. Well, that's not enough, because we know, having looked at the symptoms, there's more to menopause than that. So if you're having hot flushes, think about the temperature in the environment. Can that be controlled better? Do you have a uniform that's really not helpful for you suffering with these hot flushes? Uniforms can be made of much better materials these days that can help with temperature control. So, ask your employer if they have these things available. And just having a quiet room available can be really helpful for someone who's menopausal. And if you've had difficulty sleeping, this is where flexible working comes in. So if your employer is able to offer you flexible working, then that's fantastic to access. And there are sleep hygiene apps that employers can provide, and that really helps with the not sleeping at night as well. And then the anxiety. A lot of people suffer with reduced self-confidence and low morale, low confidence, and that's because of that hormone progesterone kicking, reducing over time. So thinking about those, again, it's creating that inclusive workplace. So if you have a workplace that's not supportive, this will add to your anxiety. So employers that think about this really do better because they get better engagement from their staff. So if you've got a workplace that is inclusive and you feel that you can talk about this, then you will perform better. And managers, they can be key. If your manager's supportive, that can be life-changing. If you can actually have a conversation about this at work, when you might not be able to talk about it at home, a manager can be pivotal in terms of helping you feel supported. So that was all I had today to go through. I'm not sure about time. I hope I haven't taken too long because it's just a really quick run through on this topic, but I'm happy to take questions at the end, and I hope some of that's been useful for you.
Wow, that was amazing. Thank you so much, Susan. Thank you. I feel like it was so great to just be able to see how learning and knowing about menopause can help in the workplace. You know, I guess I didn't think about it. We oftentimes feel like menopause is this medical issue, and we kind of, I guess, move ourselves away from it. But actually, this is affecting work colleagues. This is affecting, you know, mothers and grandmothers, and just being able to kind of help us broaden our understanding of it emotionally, looking at how policy is involved in menopause, which I never would have thought about as well, looking at how that can be a protective way and how menopause is actually affecting the economy. It's just such a great, yeah.
Apologies for my slides doing that changing thing. I have no idea where that came from. One thing I did want to add, that menopause is about men as well, because men actually go through something called andropause. And this is the one book, which I'm happy to send a link to, but you can get it on Amazon. But it's really useful way of men understanding menopause and talking about menopause. So it's not, you know, it's really important that men are engaged in this too. And if you want to learn something on your own in the quiet, then this is a book that is probably the best book on menopause for men to think about.
Wow, thank you so much. I feel like it's great to also see that it's not just a woman thing, that this is something that just happens to men in their own way, but also that men can be more aware of that in the workplace. Sometimes you see a woman with a fan, she might need more than that. It might be the emotional part of it, the mental health part of it, the therapy part of it, people on medication. So thank you for sharing, Susan. Really appreciate it. And we will take in questions at the end. So if you have questions, but you might have to run off, please don't be afraid to put them in the chat. And if you are going to be with us all the way to the end, which we'd love for you to stay to the end, then we'll be taking questions at the end. We're about to move on to one of the great aspects of our Face You talk on mental health, and that's to do with that's to do with music therapy. And so we'll be having a music interlude with Cameron J, and I'll just unmute myself so we can enjoy the music and allow this particular form of therapy to because it's a massive aspect of mental health and brain health as well. So Cameron J, over to you. She's actually a local songwriter, singer, dancer, childhood and adulthood, and she'll be with us today to give us a rendition of a particular of also being able to link music with mental health. She's a cancer survivor and a liver transplant recipient. She has worked with Face Youth since April 2022 as music tutor and assistant tutor during the Skill Club projects. That means we'll be seeing her for the Easter break, right? So she released her first singles at the age of 12 and has since then performed on various platforms and produced new albums. We're excited to have her up. Please take it away.
Hi guys, thank you so much for having me. Can you hear me okay? I just want to make sure that it sounds okay. That's the main thing. I want to make sure everyone can hear me. How would I know? Maybe I'm just going to do my own rendition of I Is on the Spiral, and then I can do an original song called Bed of Roses as well. And yeah, I hope you enjoy. Why should I feel discouraged? Why should the shadows come? Why should my heart feel lonely and long for heaven and home? When Jesus is my portion, my constant friend is He. He is on the spot. I know he watches me. I say, because I'm happy, and I say, because I'm free. His eyes on the sparrow, and I know he watches me. I say, because I'm happy, and I say, because I'm free. Here I is on the sparrow, and I know he watches. I know he watches me. Watches me. Thank you. Okay, thank you. Thank you so much.
Thank you. That was excellent. Thank you so much, Cameron. That was beautiful. You know, a lot of music is linked to improvement in mental health. There's significant changes in women and men who have different various mental health disorders, that music therapy, structured music therapy actually has been such a crucial part of their improvement. And it's even been linked to improvement in heart disease and other, medical diseases, and even in building the immune system. So thank you so much, Cameron J, for just giving us another intervention for tackling mental health in our community. And so we're moving on swiftly, and we're excited to actually have on next to speak to us Dr. Nkem Delim Ndiche. And she's a medical doctor, certified in leadership, and fellow in family medicine on the national, that's FMCFM. She's a postgraduate medical from the Postgraduate Medical College of Nigeria. She has a master's in econs and master's in health and econs, and popularly known as Dr. Delim. She's a specialist and consultant in family and a family physician, sexpert, docpreneur, health educator, author, blogger with experience in postpartum care, child and adult nutrition, health, life, and lifestyle coach. She is a health educator to individuals and organizations and a speaker on various media platforms, including being a co-host in SGHS, a maternal education platform on Facebook with hundreds and thousands of women. We're excited to have her present to us as she talks to us about postpartum mental health, an aspect of our community that has a lot of stigma around it, but it's something that affects a lot of women and families and men. Postpartum women affects men too. So take it over from us, Dr. Delim. We're excited to have you here with us.
Thank you so much, Alice. And thank you to everyone here. I appreciate the opportunity. Thank you so much to the last speaker for throwing so much light on menopause. Could you kindly confirm if I'm audible and visible?
Yes, we can hear you, we can see you.
All right, so I'll be talking about postpartum depression. The interesting thing about postpartum depression is the fact that a lot of women have not heard about the word postpartum depression because it's actually a tongue twister. And then we have much less men who have heard about the word postpartum depression. Depression is relatively more common among people. They've heard about it, they might not fully understand it, but postpartum depression, we just have a handful of folks that have heard the word postpartum depression, and a smaller number who even know what postpartum depression means. All right, this is the outline I'll be following as we go along. We'll be talking about the postpartum period, postpartum blues, postpartum depression, psychosis, the diagnosis, treatment and support, and then societal stigmas and your role in the management or prevention of postpartum depression. What is the postpartum period? Postpartum is actually a word for labor, right? And then postpartum basically means after labor, or basically means after delivery. So we have that period. It is relatively about 6 weeks from birth to about 6 weeks. Usually after the mother delivers, she usually has to have a postpartum or postnatal visit 6 weeks after delivery. Usually during this period, the woman experiences various changes. I'll just touch on a few. Her body changes, the size of her stomach changes. Down there, her vagina, how she feels there changes. A lot of things change about this woman, and usually many times they're usually overwhelmed. Of course, in the beginning, it's usually with a lot of joy following the delivery, especially when that follows a live baby or live babies. That's usually what happens. And then she has to, get control or become in charge of her emotions, because you're usually all over the place following delivery. Heading on to the postpartum blues, postpartum depression. So many times it's common for a woman to be a little sad or anxious in the first few days after delivery. It's really common, and it fades off in a couple of days or a couple of weeks. And then she usually shows up after about 6 weeks, just like I mentioned, to see her doctor. But if she has any pressing complaints prior to the 6 weeks before the postnatal date is complete, she should show up at her physicians for a checkup. I already talked about postpartum blues. Basically, you find out that some of these mothers, because they are overwhelmed with a lot of emotions, they could feel sad or miserable just within a few days of delivery. It's usually common in many women, up to about 80%. It is common, it is normal, it is okay, and it is fine. They usually disappear within 2 weeks, and she'll just need support. Those around her, her partner or her spouse, she just needs support. Change that lasts for weeks, lasts for months, but specifically it actually interferes with her daily activities at home, having to look after herself, having to look after her baby, or even having to look after her husband. About 10 to 15% of women are affected. Again, the symptoms are usually long-term and not as transient as in postpartum blues. Postpartum depression is a more serious mood change. I hope I'm being clear. Now, what are the causes and risk factors of postpartum depression? Well, the causes are not exactly something that we can pinpoint, because the theories are basically unclear. However, we have a lot of risk factors that could increase the risk of a woman developing postpartum depression. In some cases, some of these women would have had depression that was present before the pregnancy. But a more significant risk factor for developing postpartum depression is when this woman had or developed depression during the pregnancy. Usually, such will evolve into postpartum depression. If she had a previous history of having postpartum depression in a previous pregnancy, or she's had previous episodes of sadness or depression that occur during certain times of the month, usually related to her menstrual cycle. This includes women who suffer from premenstrual syndromes, right? Menstrual dysphoric disorder, right? Dysmenorias. This category of women have a risk of, developing postpartum depression. Those who take oral contraceptives and had depression, they are all at risk of having postpartum depression. Then if she has a history of depression or postpartum depression, family history of this, she could be at increased risk of developing that. And then stressors. I already talked about how the woman's emotions could be all over the place. During delivery, right? It will happen 10 months after delivery, up to 1 year. In fact, it's been extended to 2 years in some cases. So stressors such as having relationship stress, she's had her baby, she's quite stressed, having financial difficulties, or she's a single parent without a partner to assist her emotionally, mentally, and physically. All of this could also be triggers. I'll hone down on financial difficulties. In many parts of the world, when women give birth, they stop working at that time for a period, a minimum of 3 months. In many cases, it's been extended to 6 months in some parts of Nigeria. And then in many parts of the world, 1 year, 18 months, right? And it is expected that at her place of work, she will continue to receive her salary, right? But it's sad to say that in many parts of Nigeria, we find out that there's some women who, when they give birth, they are not even entitled to maternity leave, right? Some of them have to try to make ends meet. They are so financially constrained, and they're trying to run and head back to work a month after delivery. This has psychological effects, negative consequences on that mother, the baby, and the family as a whole. Other risk factors include, like I mentioned earlier, lack of support from a partner or family members, problems related to the pregnancy. Some had called delivery or near-death delivery. Some others will have preterm deliveries, or babies with birth defects, or babies who are specially, abled. All of this could also put her at risk of developing postpartum depression, complicated feelings about a current pregnancy. Maybe if it was unplanned, a teenage pregnancy, or she had completed her family, and then all of a sudden she finds out that she's pregnant. It could also put her at risk of depression. In other cases, problems with breastfeeding. This is more common among first-time mothers trying to, figure out how to breastfeed, get into the correct breastfeeding position, trying to adjust her body pains, her neck pains, and all of that, especially if she has to do all of this without assistance from anybody. The earlier speaker had already mentioned about hormones, imbalance in hormones when she was talking about menopause. However, when it comes to postpartum depression, the sudden decrease in the levels of these hormones that occur after delivery could contribute to postpartum depression. Also, a lack of sleep because of the emotional adjustment, mental adjustment, and physical adjustment to the baby could put this woman at risk of developing postpartum depression. And then we have a gene that could mark for postpartum depression. That's basically a woman who is genetically predisposed to postpartum depression could be at risk. So these are most of the risk factors. However, this list is not exclusive. What are the symptoms of postpartum depression? Basically, they are the symptoms of depression that happen in a woman who has just given birth, up to 6 weeks and months after delivery. The symptoms could begin gradually, could be subtle, or more suddenly. Like I mentioned earlier, however, these symptoms will significantly impair the woman's ability to function. It will significantly impair her ability to care for herself, her family, or her baby, and her baby. You find out that sometimes she just sits down and cries for hours without provocation. She gets into mood swings. She gets upset from one extreme to the other. She just sways from one mood to the other. Other symptoms also include extreme fatigue. She is severely overwhelmed and exhausted. She barely sleeps. She has headaches. She has body aches. Of course, this is not rocket science. She will completely lose interest in sex and many other activities. She could have anxiety or panic attacks. It's important to note that women who suffer postpartum depression do not exactly have all of the symptoms that you could touch here and there. So a woman who's going to be diagnosed with postpartum depression will have some of these symptoms, but definitely not all of the symptoms. Other things also include a loss of appetite or overeating. So she could swing from anorexia to gluttony. I'd mentioned difficulty functioning, a complete loss of interest, or unreasonable worries about the baby. Talking about unreasonable worries, You know, she could hold the baby and start crying and go, she doesn't even know if she'll be able to care for this baby up to secondary school. She doesn't even know if there's a good secondary school for her baby. This is a newborn that we're talking about, right? Unreasonable worries, illogical worries at that time. And then she could have this overwhelming feeling that she's incapable of caring for her baby or being inadequate as a mother. Then she could have guilt about even expressing or experiencing these feelings in the first place. Where it begins to get worse is where she begins to express fear of harming the baby, you know, or suicidal thoughts for herself. Then these women may not bond with their babies because there's something wrong, of course, at that time. And as a result, if she goes on with postpartum depression that has been undiagnosed or untreated, it means that the bond between her and that child will not be strong, one, and the child might have emotional, social, and cognitive problems later. And that's why we are having this conversation. This is because mothers actually are the bedrock of the society. They help to develop the family unit, and it's the family unit that goes on to become the global village, the world that we know as it is. That we have broken children, broken young men and women in the world, basically many times stems from how they grew up or stems from the care that they received from the mother. Where that is suboptimal, the children may turn out suboptimal. In other cases, partners may become depressed, and depression in any parent may cause stress. It is said that a happy woman means a happy home. A sad woman definitely means a sad home, on a lighter note, if you get what I mean. How is postpartum depression diagnosed? Usually, the mother knows that something is wrong. She might not be able to put a word or her feelings into words. Many times, if she has female relatives or friends around, they might feel that something is wrong. It's interesting to even note that some women who have been diagnosed with postpartum depression, their husbands or partners never had an inkling into what the woman was going through, because it actually has to do with a lot of internal suffering that the woman experiences at that time. So it is actually a significant issue. So a doctor evaluates her and gives her a diagnosis. In other cases, by the time she presents for the postnatal checkup at 6 weeks, a postnatal screen is actually done for her, and the doctor gives her a form to fill and all of that, uses that to screen her to see if she's got postpartum depression. If she has, a diagnosis is made and management is started. But it is important that early diagnosis, catching this early is actually important for the recovery and stability of this woman and her emotions, and is also important for the baby. So if you have any woman around you, we are here, we are males and females listening in. We are a brother, an uncle, a dad, granddad, and all of that. We are directly or indirectly linked to women around the world. And it's our responsibility to also reach out to them, support them, be empathetic with them when we see or observe some abnormalities in these women. We can encourage them, especially if the symptoms persist for 2 weeks or more, to seek help. Because there's a lot of stigma around it, which I'll be talking about as we go along. There's a lot of stigma, but ourselves should be the safe spaces of other people. So if you are not a safe space, it's important that you recalibrate your thoughts, your emotions, and tell yourself, from today onwards, I'll be a safe space for people. That's very important, because the world is not kind, and you should be the kind person that the world has to help. How is postpartum depression treated? Without treatment, postpartum depression can last for months or years. It's important to know that about 1 in 3 or 4 women who have had postpartum depression will have it again. This also relates to people that have depression. If it's undertreated or poorly treated, you find out that they have it again. Postpartum blues, basically, you just need support, care, and all of that. However, postpartum depression needs professional help. We go to see a physician, they'll recommend psychotherapy, they'll start you on antidepressants, but there are other things that could help. We talked about music therapy just a couple of minutes ago. Other things include dance therapy, exercise, yoga, aqua therapy, that's swimming, or just soaking in the bathtub, aromatherapy, and then again, soul stirring, soul calming music. There are also apps that will help, to produce sounds of nature, YouTube handles that have all of this kind of calming music that could help. So it's actually all encompassing. She just doesn't do the psychotherapy and everything gets well. No, no, no. There's also the place of social support at home. There's also the place of social support if she eventually resumes and gets back to work, because the woman who gave birth and the woman after, they are not the same. She will need all of the resources that she can lay her hands on to get better and stronger. Postpartum depression, to a great degree, there's a risk, to a great degree, can actually be reduced, or the risk of developing postpartum depression can be greatly reduced when this woman or these women or these mothers are able to get as much rest as possible. They sleep when the baby sleeps. When the baby is calm, they just take some rest, take those little power naps. It could help her refresh. It could help the brain refresh at those times before the main sleeping hours. Not trying to do everything. For example, not trying to keep a spotless house, have all the home cooked meals and all of that, because we have this syndrome, this super mommy syndrome, where she's Superman, she's Superwoman, Spider Woman, Cat Woman, Cat Girl. She's all of that in one. No, that syndrome is actually not a progressive syndrome. It serves to destroy her mentally, it serves to destroy her physically. As long as she can get help from her friends, from family members, that will help to go a long way in preventing the risk of postpartum depression. Talking to someone, talking to her husband, talking to her partner, talking to family members and friends about these feelings. Basically, being open in a safe space, sharing in that space, and not being criticized about having those feelings, because really those feelings are real, those feelings are valid to her. Taking our shower and dressing each day. Remember that the symptoms of depression are quite dark. They're quite dark and deep. And she might just lose interest in every other thing. She doesn't take a bath, she gets unkempt and all of that. It's important to, feel good about yourself. She showers, she makes up, she dresses every day and prepares for her day as it should be. This could contribute to reducing her risk of developing postpartum depression. Getting out of the house, for example, I talked about exercise, run an errand, meet with friends, take a walk, etc., could contribute to reducing her risk of developing postpartum depression. Spending time alone with her partner, talking with other mothers about common experiences and feelings. In many parts of the world, they have what's called a doula, right? These are people who in many cases already had their children or had one child, and they come to stay with you, assist you, help you care for yourself and the baby. In Nigeria, in a particular tribe in Nigeria, in the Igbo tribe in Nigeria, that practice is called omugo, right? And we have many tribes in Nigeria that practice it. She could also join a support group for women with depression. And it's important to recognize that fatigue, difficulty concentrating, doubts about being a mother are normal in many cases. About being a good enough mother are normal in many cases. But when it begins to persist, she needs to seek help. Now, this is a rhetoric question. You answer it to yourselves. Did you know that women should see their doctor?
Hey, Dr. Deline?
Hi.
Oh, you're frozen. Could you answer the question again? We didn't get to hear the question, the rhetorical
That's
question.
fine. That's fine. Did you know that women should see their doctor immediately if they continue to feel sad and have difficulty carrying out their
I think we've lost Dr. Deline for this. Oh, she's back. Hi, Dr. Deline. Sorry, we just missed that last question again. When you're ready, please feel free to interrupt me with the last slide so we can read that last question. I'm interested to to hear the question as well. Okay. Has she typed to anyone in the IT department yet, or?
Yeah, she's still trying to connect. The
Okay.
third world problems.
Oh, yes.
Dr.
So,
Chi, okay, she's back.
great.
Apologies, I was experiencing a third world issue.
Mm.
I hope you can bear with me. Is it clear?
Yes, we can see your screen as well. We can hear you. Thank you.
Okay. All right, thanks. Yeah, I said, again, the rhetoric question. I asked, did you know that women should see their doctor immediately if they continue to feel sad or have difficulty carrying out their usual or normal activities for more than 2 weeks after delivery, or if they had thoughts about harming themselves or the baby? Before now, did you know that if you had anybody say that to you, the person should see the doctor? Basically, it's actually a medical or psychiatric emergency if she is in such a position. In other cases, she could even be hospitalized if the doctor feels so. So it's really that important in medical practice. And then heading on, we're just heading to postpartum psychosis. It's actually a more severe disorder beyond postpartum depression. Here, there's depression, but it's combined with other symptoms that could include violent thoughts. We've heard about women who try to kill their baby or try to throw their baby, and all of that. It is usually under the group called postpartum psychosis. Sometimes hallucinations. She sees things, she hears things, people talking to her about harming her baby, bizarre behavior. In all of these cases, this mother will need urgent medical attention and she should be hospitalized. However, postpartum psychosis is beyond the conversation for today. I just wanted to touch on that because it usually follows delivery too. So sometimes it could present with baby blues, sometimes it could present with postpartum depression, and sometimes it could be outright postpartum psychosis. What is your role when it comes to dealing with the stigma? Basically, it is global, right? The stigma is global. It's not just in Africa. It's not just in the UK. It is everywhere. It's important to note that the feelings of this woman are valid. We could help her validate her feelings. And help is needed. You should have the insight to know that help is needed. She's not mad when she's voicing her feelings. She's definitely not crazy. She's not a witch because somebody or something, some voice is telling her to throw her baby from the 3rd floor. She's not a bad mother either. She's definitely not evil. She's not the devil. Your understanding and your empathy is crucial. Your support is important. The support of her family, her spouse, her mother, her social network is also important in improving her outcome. In conclusion, it's important for everyone here, born of a woman, to note that it is the hand that rocks the cradle that rules the world. This year's theme, celebrating the International Women, and this month, celebrating women and the mothers. The theme is investing in women accelerates progress. For me, I believe that investing in women all over the world accelerates global progress. And that's why we should continue to inspire inclusion. It's not just about women dealing with or living with postpartum depression. It's also about including our women, including our men in helping those women become who they are meant to be in this world. The healthy mental state of the mother is crucial, definitely, to the optimal and balanced output of her babies, of her growing children, and the world by extension. These mothers definitely do need all the support they can get from us. And it's a thank you for listening from me. There's a video I wanted to be shared. I don't know if you can share it. Thank you. Kindly confirm audio. I can't hear.
We can't seem to hear. The sound should be coming on soon.
I'm a terrible mother.
Thank you.
What if people find out? I've made a mistake. I'm no good. I don't want to do anything. My baby, she'd be better off without me. I'm a failure. It would be better if I was gone. What am I saying? That's crazy. Something's wrong with me. I can't do this anymore. All I wanted was to be a mom. All I wanted was to be a mom. I don't feel anything. I'm nothing. I'm empty. I'm a robot going through the motions. I can't give up. I can't go on. I want to die. All I wanted was to be a mom. All I wanted was to be a mom. I'm so alone. My baby deserves more. I'm nothing. I'm empty. I'm empty. What if I let the stroller go? What if I drop her? What if I do it on purpose? Oh God, what's wrong with me? I'm crazy. I'm crazy. All I wanted was to be a mom. All I wanted was to be a mom. How much milk has she had? She's starving. I'm a terrible mom. 10 ounces in the morning. I'm empty. How many diapers has she filled? I have to clean the house. I have to clean the house. I can't sleep. I'm so tired. All I wanted was to be a mom. All I wanted was to be a mom.
Thank you so much. I do not have the rights to the video. It was actually from the Australia Maternal Health Association. And basically, those were the internal narrations of a woman dealing with postpartum depression. I hope that some of you have questions and will be taking it at the question and answer session. Thank you so much.
Wow, excellent. Thank you so much, Dr. Deline. That video was so powerful and such a great way to show us that indeed what people, a lot of us deem as such a joyous moment and time of a woman's life isn't still modeled with a lot of other anxieties and things that can lead to even more intense and more severe mental health disorders. Thank you so much for going into just the causes and the symptoms, as well as prevention and interventions and remedies and ways in which other people around the mother can be of help, and even just touching on the extremities of postpartum depression and how worse it can get if not treated on time, such as psychosis. And it's such a massive field, especially I work with I'm a neuroscience researcher, and that's more molecular level. But hearing just hearing everyone today has just really broadened my understanding of looking at the sociological effects of things and the medical side of things. So good. And just to round off, as we're about to go into question Q&A, please, if you have questions and you may not want to, you would like me to read them out, please feel free to put them in the meeting chat. We already have a question, which I will be asking aloud. If you are wanting to ask a question, please feel free to raise your hand and I will be sure to try and get to you as quickly as possible. But today has been informative, and I know all of you would agree. It's been amazing just from thinking about the issues that affect women and how that affects the economy. And Dr. Deline, she mentioned, looking at the UN and celebration of women today, looking at investing in women to accelerate progress. And Susan talked about the economic impact of menopause. And so did Dr. Inkem talk about the idea of not being able to go back to work because of mental health issues. So that actually affects the economy. So without further ado, I know I have lots of questions. I'm sure you guys have questions. So I'm going to go into the first one that was actually asked, and this was actually directed at Dr. Susan. You never know Dr. Susan, but Susan, which was, I'm going to scroll up. And it is for company to provide help for people with menopause. Does it depend on size of company?
This is for any size of company in the UK, so it would be different in different companies in different countries where the legislation is different, but it doesn't matter what size the company is. But it doesn't have to be expensive interventions, as you could see in the list I had there. It can be quite simple things that can make a change, even just being able to talk about it. So it's not a case of having to spend a lot of money to make these adjustments, but it doesn't matter about the size.
It's so interesting to think that there are times that people might think, or things people might think are limiting factors, but they're not actually. You know, I remember you were talking about different things that workplaces might not be able to offer because they think they have a limiting factor as to what they can offer. But actually, when you look down at it, there are things that can be done. And if we take away those limiting factors, we'll be able to help more women. So is there any other questions that anybody wants to type out, or any questions around? I'm trying to see if there's anyone with raised hands. I know that there's a Dr. Trudy who would like to comment, but if there are any questions before we get our comment, please feel free to raise your hand. But we'll go ahead and take the comment from Dr. Trudy right now.
Yeah, thank you guys. Can you guys all hear me?
Yes.
If you're able to hear me, just say hi. Alice, you've done an amazing job. Susan and Kem. I just wanted to commend you guys because whenever we talk about issues that bother our women, you rarely see men coming in. But I happen to be a part of this amazing organization, and we've done an amazing job. Dr. Kem happens to be my co-provider in my women's health group. And each time we talk about menopause and PPD, which stands for postpartum depression, or PPP, postpartum cycle, especially from Nigeria, majority of us are from Nigeria, we tend to stigmatize, we tend to select, we tend to remove ourselves from certain conversations with the concept of it's not my portion, and things, that ordinarily should be a milestone, things we should look forward to celebrating, like there are certain conditions that are not medical problems. Becoming pregnant is not a medical problem. Going through menopause is not a medical problem. It's a milestone that every woman is going to go through. When God designed women to be entirely different from men. So the ability to have the knowledge, the attitude, the practice, and perception of important things you should know as a woman and as a man, you can be the husband, you can be the brother, you can be a friend, but we should all know about this. We should not extricate and remove ourselves from topics like menopause. I was expecting to have a sold out event today. So many people are attending, but when women begin to feel somehow like, when she was making her presentation, there was a time she felt she had dementia, she's got a couple of things she couldn't explain, night sweats and all those stuff. It's what makes you a woman. You have to get there at some point. Now, there's another aspect that she didn't really highlight on. You see, one of the biggest problems we have in matrimony is not just lack of money. It's lack of communication. It's lack of affection. It's lack of intimacy. It's lack of ability to perform your conjugal role, which is bottom line sex. There are roles that all these things will play. There are certain things that will change in your body when your testosterone level is low, when your estrogen level is low. These are important hormones. So she mentioned testosterone, progesterone, and estrogen. So every woman in our community should be conversant with this. Take a moment and review yourself. There are certain things that happen to you can't explain. The best person to help you to understand that is your doctor. And we should form the habit of going for our well woman check. When you go for your well woman check, We're going to keep eyes on what might happen in your family. There are some familiar things that can happen in your family. There are some women that might be predisposed to early menopause. So the time your mom entered menopause will likely be the time you're going to enter menopause. So assuming your mom had early menopause, which is a menopause before age 40, possibility you're going to have it is there. Possibility your sister might be having it. So we need to open up. We need to start this conversation on a bigger scale. If you notice, Dr. Nietzsche was practically in a hurry. PPD, PPP, menopause is not a topic we can even use 1 week to talk about. So if you're attending this event today, you're blessed. Now we should stop the spiritualization of medical issues. So there are so many women that ended up in the churches. There were so many women that actually ended up in all those prayer houses because they were showing signs of maternal bliss. They were showing signs of PPD, postpartum depression. So instead of understanding that a mother that wanted to be a mother, by the time she got what would make her happy, suddenly is sad. Common sense will tell you that it's not normal. But we are so good in banishing people. We are so good in condemning them. We are so good in calling their names, especially from women that should be protecting women. So when we talk about International Women's Day and learn how to support each other. Learn how to identify all these red flags. Nobody will just wake up one day and start getting sick. There are red flags. And how we support people that are genuinely going through problems is very, very important. Any mother can crack. Being a woman is not for the faint-hearted. So you need to understand how to support them. You need to validate their claims. You need to validate their symptoms. You need to give them room to vent, because talking therapeutically is actually one of the biggest ways you can mitigate all this. So I just want to commend the two women that presented and the musician and Ify for organizing this. If you're in this gathering, you're blessed. I will just plead for both of them to make their slides available so that you can go home. Thankfully, this event is recorded and you can run it over and over again. It's possible your mother, your sister, your auntie is currently menopausal, is currently having postpartum depression or psychosis. This can be a lifesaver. It's a topic and a conversation we should start today to be the difference in our community. Thank you, guys.
Wow, Dr. Chin, thank you so much. You touched on such great points, things that I think we don't really talk about as a community. You know, I'm a mother of twins. I have twin boys. You can imagine if with each baby there's a higher risk of postpartum depression. You can imagine what it can feel like when it's twins. And you're so right when it comes to spiritualizing things, because seldom do I hear of churches having a menopause women's prayer group. Seldom do we hear of churches or other places of community or other religious sectors having meetings for women with postpartum depression. I think that it's because we feel like, for example, some of the symptoms that Dr. Deline spoke about, we kind of feel, isn't that, you don't really talk about that. That's not something to talk about. Or menopausal symptoms as well. We think that's normal. Like, what's the difference in that? But these are things that can go on to affect a woman mentally. And so it's so good for us to bring that conversation and highlight it and put it out into the open, because the less we talk about it in the open, the more we'll think that it's a taboo. And there's also natural progressions of a woman. Menopause is one of those things that's it's inevitable. So to have these kind of conversations from the medical standpoint, the sociological standpoint, and also just in terms of just being the emotional side for mental health is very key for us as a community. So thank you for sharing that as well. There's a question from social media that says, thank you, Susan and Dr. Deline, for insightful presentations. Are there any lifestyle changes or self-care strategies that can help manage postpartum depression and menopause? So I'll start this question with Dr. Deline and then also Susan as well, they've asked about, are there any self-care strategies that can help manage postpartum depression and menopause, and any lifestyle changes? Dr. Deline is there. We'll start with you. Yeah. And if not, then...
Am I audible?
Yes, we can hear you. Thank you.
Yes. So basically, there are lifestyle, approaches that can assist in the management of postpartum depression. I'd like to start from the last one. You asked about the risk of postpartum depression recurring in subsequent pregnancies. Yes, postpartum depression can actually recur in subsequent pregnancies, especially if those pregnancies are really stressful. However, on initial diagnosis of postpartum depression, if it is diagnosed early, treatment is started early, and she completes treatment, of course, she recovers completely. She has less risk of developing postpartum depression in that subsequent pregnancy. And so early diagnosis is key. Early and appropriate treatment is also key in reducing her risk in her subsequent pregnancies. I hope that's clear. And then lifestyle changes that can help in those women dealing with postpartum depression. I talked a lot about support from her friends, her family, her mother, her partner. Dr. Chudi mentioned communication. She always needs to verbalize in a safe space to a safe person, right? Whether at home or at the hospital, she always needs that. Other things also include there's psychotherapy, there's therapy, there's medication, pharmacotherapy. But for lifestyle, exercises help, yoga helps, breathing exercises help, stress relaxation techniques help. Aqua therapy helps. That's swimming or soaking in a bathtub, all of this, the spa treatments, they help. Sauna treatments, they help. I hope that's clear. Then music therapy helps. Even what we call equine therapy, just getting on a horse and going out there helps. Walking, just stepping out of the house, walking, getting that gust of fresh air, running or jogging down the lane, things like that, just moving. It helps because all of these serve to release what's called endorphins, feel good hormones, and it helps to, help her balance at least. So those are some lifestyle measures. Other things also include food. There has to be a cut down in sugars. This means added extra sugars, glucose, and all of that. She has to cut down on that. She has to have proper meals. This is what we call balanced diet or the healthy plate, where there's appropriate portions of the carbohydrates, the protein, vegetables, fruits, lots of fluid. There has to be cut down in caffeine, the teas, the coffee, all of that. There has to be a cut down in soft drinks, sodas. There has to be a cut down in alcohol or completely no alcohol because she should be breastfeeding, right? And then there has to be complete cut down. Smoking, we don't even want her to be smoking. And then if she's a substance user, there has to be a complete cut down in substance use. I hope that's clear. All of this will support her recovery from postpartum depression. Thank you.
Thank you for sharing that. So Susan, the same question was asked to you as well. And this is any lifestyle changes or self-care strategies that can help manage menopause.
Yeah, and I would say everything that Dr. Daleem has just described there would be equally useful around menopause. I think it's just about thinking what serves your body well and what doesn't serve your body so well, and knowing your own body, because what works for one person won't work for another. There's a couple of supplements that you can think about taking. So calcium, because we talked about bone deficiency, but any type of supplement, again, you need to speak to your GP. But vitamin D is also a useful supplement to take. It's associated with sunshine, but we don't get enough of that, certainly up here in Scotland. So vitamin D can be a useful supplement, but again, I am not a medical individual, so I would recommend you talk to an expert about that. But everything that Dr. Daleem said, exercise, improve your sleep, so use an app to maybe help with your sleep. Things like that will make you relax. Mindfulness, doing a bit of mindfulness, meditation, yoga. I think everything that Dr. Daleem mentioned there. But the only other one is thinking about your mental well-being. There's something called cognitive behavioral therapy, and that is it's a type of psychotherapy that helps you reset your mind and the way you think about things. So that can also help too. But I think really you summarized it really well, Dr. Daleem. You're the expert there. So I think all of what you said, plus a couple of things I've added.
Wow, thank you so much both for answering that question and just thinking about all the different lifestyle changes that we need to make in order to help manage any form of postpartum depression or menopause. There's a comment here that says many African women abroad do not have the type of support we have back home. I suppose it's important to be part of a community, especially when you're pregnant. I think that's so correct, right? Communities are so important. And wherever there isn't a community, it might be that, you know, from our discussion today, we're able to forge one to try and help other people who might be in situations whereby they don't feel there is a safe space to talk. Just as we, you know, wait for some more or other questions, I feel like after having, you know, babies as well in my case, you kind of feel that culturally no one really tells you what they actually went through or whether they have thoughts of sadness. And so in in some cultures don't really have a passing down of that knowledge. Or let's say, for example, when my mom's mom was going through menopause, she maybe didn't share that with my mom. Then my mom's now going through menopause. She's not really sharing that with me. You know, it's almost like I know that she's getting hot or she's having hot flashes. I can see her with a fan, or I can see that sometimes her mood is elevated. Sometimes she's not as happy. And I'm thinking from a medical standpoint, I know that those are symptoms of depression, but she's not culturally aware that she can actually have that conversation with me. So without that passing down of knowledge, you know, to generations, we don't feel that we're in a position where we can talk about it. It's something that we're definitely going to experience, but we may not have the language to talk about it. So therefore, we may not even know what a safe space looks like, because we're thinking, how do I tell my mom, who's so happy to be carrying twins, that I'm actually not happy? And I think as well culturally, how we deal with unhappiness, or how we deal with a woman expressing lack of joy is quite, sometimes I might add, from a first generation Nigerian perspective, it sounds insultive. Like, you know, how dare you say you're unhappy? What do you mean you're unhappy? You need to be. And so, you know, they may not, in their mind, they've cultivated a safe space, and they're trying to encourage me, my aunties or people who come to take care of the babies are trying to encourage me by telling me you're not allowed to be unhappy. But that might not be the kind of encouragement that we may need. Um, so yeah, so that's something that personally I can see is so important, to kind of have the language, kind of understand what a safe space looks like, have communities, create other communities for people who are experiencing menopause. And I don't want to use the word suffering menopause. I think when we use that, it just feels like something that is a form of a suffering or a disease, but it's something that's a natural progression in womanhood, that you are actually going to eventually face in various ways. So it's more of like experience in menopause. And then as Dr. Delim had spoken about, there are particular forms, or I want to use the word lighter forms of postpartum depression, that's more like blues, that that at least let's start with that being easy to talk about. But these are all things that affect the woman and her mental health, that if we just have the communication, like Dr. Chidi mentioned, I think that will go a long way in preventative methods for postpartum depression and managing menopause very well. Are there any other questions from any other platform, or any other comments that anybody would like to make? It's been such a great session today. And like Dr. Chidi said, this can't even, we won't end at speaking about these particular issues, because it affects every single woman in past generations and generations to come. And now that medicine has given us the language, they've given us a form of diagnosis, they've given us reasons and symptoms and interventions and preventative methods, psychotherapy, as well as, you know, pharmacotherapy or pharmacotherapy. There should be more discussions like this, to try and help women who may be in a place where they feel a bit stigmatized by speaking about it. So yeah, it's been so amazing hearing Susan speak about issues of menopause that I could have never even thought about, and also Dr. Delim just highlighting the different aspects of PPD that other people might be suffering around us, and things that I actually think that kind of applied to me. I don't know about you guys, but I felt, wow, I actually had some of those thoughts, but I would have never, put on that, more of that diagnosis. I think more blues for me, but being able to have that title. Dr. Daleem's hands raised, and be so lovely to hear you speak again. I'm gonna just unmute, and please unmute yourself. Oh, you're still on mute. Okay.
Am I audible?
Yes, we can hear you. Yes.
Okay, thank you so much, Alice, for sharing such vulnerability. I appreciate that. I appreciate that. And it was just to lend my voice to something that you said. For some reason, we have our generation, we have parents that of this generation who rather keep mute. You find a mother who has pretty daughters getting married, and literally these girls have no idea what they are getting into until they get into it. And then mommy is talking, is I married now? She too, she will go there and see. For some reason, I don't know why they have such an orientation. Now, the responsibility now lies on us. We are now left with that responsibility to educate our own daughters, our own sons, so that they'll be better informed. Now, what this means is that they'll have an insight, and of course, down the line, down the forthcoming generations, right? They'll be better informed, and they'll also be able to make informed decisions. I can imagine you holding twins, and then you tell mommy, I'm not feeling happy. Mommy, I'm not so. They will rebuke you. Get away from me. Devil, I rebuke you. Where did that come from? Like, she has no insight into what you're saying. Like, what's this my daughter trying to say? She wants to implicate me. Me. Those are the thoughts that run to. She wants to disgrace me. She wants to embarrass me, in the presence of my friends. But again, like I said, all of the feelings are usually valid, no matter how it's tried to be watered down by anybody you tell. They are valid. You are not mad. You are not running mad. You are not running crazy. You are not abnormal. It could be blues. It could be depression. The beautiful thing about depression is that it could actually be completely treated. That's the beautiful thing about it. And she could go ahead to live a fulfilling reproductive life, a fulfilling sexual life. Another thing that is important, Dr. Chidi actually touched on it, is conjugal bliss, right? It also affects that when it comes to relationships, right? The woman is completely uninterested in sex. And we already know how that ripples down, the ripple effect of that, and the effect that could have on the marriage. If the man is forced to go out of that marriage, we already know the kind of repercussions that could, spiral into. So it's actually deep. It's actually serious. A lot of women have begun to reach out. We have some of these cases in SGHS where I co-host with Dr. Trudy. We have some of these cases. In fact, you find out that after that first baby, then you find men that ridiculously, of course, logically, are jealous of those babies. It was when this baby was born that the problems in the marriage started. Because men can be jealous, jealousy that I don't understand. It was when this baby came that all the problems in the family started. Meanwhile, if you get down to it, have good conversations, go for therapy, you actually be able to get down to the base, to the root cause, manage it, and they're able to live their lives sexually, spiritually, and all the alleys, as it were, and have a fruitful, enviable home that people will be proud to, talk about as examples. So that's just what I wanted to share. That came to mind when you were talking. Thank you for sharing that vulnerability.
Wow, thank you so much, Dr. Daleem. I think it's just been an incredible day, and that's why I think the work that Susan does is so important as well. As we talked about women who don't live in their cultural settings, they live maybe in in the UK or the US, being able to have cultural sensitive interventions is so important as well. So I want to just say a massive thank you to even our music therapist. It's just been amazing just to be able to have everybody here with us. Cameron, Susan, and Dr. Delim, we're so grateful for your time to educate and to inform us. And at the end of the day, it's all about empowerment, just like Face Youth. It's all about empowerment. And if we, as the mothers, grandmas, aunties, godmothers, in-laws, sister-in-laws, sisters are empowered, then the children around us will be even more empowered, because they see that with that knowledge that we've gained, that we can actually empower others around us. So we're so grateful for your time, and thank you for everyone who tuned into the session today. We're excited about the next one, excited to hear. I'm going to read some of the comments before we go. Someone had asked, just in case people can't see, that they'd like to know the menopause age that was mentioned and what age does it start from. Susan answered with the average age 51 in the UK, but any time between 45 and 55 on average. There are people who are talking about how happy they are with the session, and blessings to all. Susan had mentioned, thank you for having me. I've learned a lot today as well and love the music therapy. Thank you. And Uche Noel has said, a culture is of the opinion that during postpartum, the man should stay away from the nursing mother, while another culture, as well as the speaker, noted that the man should be around and support the woman. And that's so true, you know, especially in some cultures, you know, the difference, and also the kind of help that Dr. Delim was talking about, which is that for men to be aware of the kind of needs that women have. But what about if that's not culturally accepted? So that's a really, really good topic as well to continue to discuss offline as well. Face Youth, Iffy, I'm gonna mute so that she can actually talk. But she actually wants to say thank you to everyone who attended the seminar today, and the recording will be shared on YouTube. So with the slides, they'll be also shared. And Dr. Delima said, if I've been able to help one person understand postpartum depression, then it was worth it. Thank you, Face Youth. There's thank you, Susan, Dr. Delima, Cameron, and Jay. It's been amazing having you guys. I'm gonna actually mute and send it over to Iffy, who will continue to say bye to us. And also someone also mentioned thank you to the guest speakers. Well, basically lots of thank yous from everybody. Okay, then over to you, Iffy.
Thank you so much, Alice. This has been very insightful session. I've learned so much, and I'm sure everybody will say the same. Thank you, Alice, for great moderation. I don't think I could have done a better job. Thank you for giving your time and talent. Thank you, everybody, for attending today. So our next event is on the 20th of April. But I would like to thank especially the speakers who give their time. We don't pay any of the speakers that come on the platform. We'd also like to thank our sponsors, the Scottish Government through AGVO, for doing this. You know, we speak about mental health and stigma reduction, and we can never speak enough about it. Do you know that mental health affects 1 out of 4 people? And the way it affects young people is different from how it affects adults. So according to a research by MQ, 75% of those living with a mental illness started developing symptoms before the age of 18. So that's why we are targeting young people and their parents, because we want to catch this young. So this was one of the reasons we launched this mental health awareness and stigma reduction initiative to tackle mental health issues in young people, especially from its onset. Mental health needs unashamed conversations. Stigma and lack of understanding are 2 barriers that keep people, especially from those from Africa and other ethnic minority communities, from seeking help regarding their mental health issues. We've been running this program for the past 2 years, post-COVID, and the feedback has been amazing. I think we've dropped a feedback form on the chat, and we're going to be sending it out as well. If you can send your feedback, it will be greatly appreciated because it will help us to better put the program together. Thank you so much again to Susan Grayson, who graciously accepted our invitation even on such short notice. Also, Dr. Dilling, you were amazing. Thank you, Alice, for great moderation. Cameron J, music as well for the music therapy, and everybody working behind the scene. I have administrative assistant, amazing praise, and the IT Williams, and all the graphic designers, Marvel, and everyone who's contributed to make this seminar a great success. We are grateful for all of you. Thank you so much. Please join us on the 20th of April next month, 2004, for another edition. We're going to share out the topic. We haven't decided yet. So if you want to hear about anything, if you want us to talk about or address any issues, please send us an email, info@faceyouth.org. Thank you once again and have a good evening. Thank you. Williams, you can play music before. If you have any questions or comments, you can raise your hand. We'll unmute you. Otherwise, come to the program. Thank you.